All right, so let's talk about quality. How do you define quality of healthcare? Well, there are many metrics we can look at. I'll run through about 4 or 5 of them. Here's one that I liked a lot. It's called avoidable mortality. It's a study done by the Commonwealth Fund study, and it ranks 19 countries in avoidable mortality. I highly recommend you read this book. It starts off talking about a young woman who, when she graduated from college, she was diagnosed with systemic lupus, let's see if I can pronounce this, erythematosus. I didn't pronounce that right. And because she was just getting started in life, she wasn't able to get insurance because she had a pre-existing condition. And she died at the age of 32. And the book interviews the doctor that treated her, who is still very upset and emotional about the fact that this was a woman who could have lived a long, healthy life if she had health insurance. So there is a cost to having those 47 million Americans in the United States not covered. Let's go back to that graphic. So the United States is 15th among those 19 countries in avoidable mortality. 22,000 people in the United States die each year because they do not have health insurance. 22,000. All right, let's look at the next one. Another metric that people look at is infant mortality, deaths per 1,000 births. And you can see that the United States has a much higher infant mortality rate than many of the developed countries. And this is despite the fact that we have more neonatologists per 10,000 live births than any other country. We have almost twice as many as Canada does, and we have more than twice as many as the United Kingdom does. And yet, because 47 million Americans don't have coverage, this mortality rate is much higher. Let's look at the next one. Public satisfaction with our healthcare system. Only 40% of Americans say that they are very satisfied with the system that we have, compared to much higher rates in other countries. Let's look at the next one. Overall health system ranking. This is a ranking rated by the World Health Organization, where they look at many different factors, and they rank France number 1, the United States number 37. I think there's another graphic that we might have missed, or I didn't see it. It's the graphic on life expectancy. I like this ranking the best. The U.S. is 47th in the world in life expectancy, but there's a different measure called the disability adjusted life expectancy, which rates life expectancy in terms of quality of life. And we move up in the ranking when you look at that expectancy. It's called the Dale rating, and it's also done by the World Health Organization. We move up to 24th in the world in terms of disability adjusted life expectancy, but we're still behind all of these other developed countries. And I think, this is my favorite rating because it looks at quality of life. If you have someone who, has a lot of pain and can't move around very much, that's taken into account compared to somebody who is treated and feels better. So 24th in the country. Let's talk about the Bismarck model again. How can we get to this? Well, the health care bill being talked about in Congress tries to do some of these things. It tries to get everyone covered. It eliminates pre-existing condition problems and things like that. But I don't think it does a good job with cost containment. And we need to move closer to the Bismarck model. If I were in the Senate right now, I would be fighting to change that health insurance bill to look more like the Bismarck model. And I'm going to close. I know we're getting really short on time. This was a lot of information, and I hope you were able to absorb it. But, we go back to that quote from Senator McConnell. This is a real problem in politics. It makes me very sad and angry when our politicians say things to the general public that they know is not true in order to try to further their aims and increase their party's agenda. This is one reason why I'm running as an independent. Republicans and Democrats both get elected to Congress and become career politicians, and they care more about increasing their party's power and getting reelected than they do about solving long-term problems. Let me finish with reading something from this book. You know, all those other countries have 100% coverage. We have 84% coverage. And Mr. Reed asks some good questions here, says some good things, and I'm just going to read it to you. Why doesn't the United States recognize a right to medical care? Are Americans so cold, so callous, so obsessed with their own lives and bank accounts that they don't care if their neighbors can't afford to see a doctor? The answer is no. In fact, when pollsters ask the basic question, do you think everybody has a right to medical care when they get sick? More than 85% of Americans answer yes. And yet our nation does not provide it. The result is that the world's richest nation allows 22,000 of its own people to die each year from treatable diseases. One reason our society lets this happen is that most Americans don't know that it's happening. Americans generally believe that anybody who needs health care in the United States can get it, either through health insurance or charity. A common formulation is, do you think people in your community, rich or poor, can get the medical care they need when they get sick? To this question, roughly 9 out of 10 Americans answer yes. So we're ignorant. We need to educate ourselves about what's really going on and not listen to what the people on television tell us, and educate ourselves by reading books like this and doing research. Americans may not know the exact mechanism for getting care to the uninsured, but they mistakenly believe that our society provides it. President Bush repeatedly assured the American people that they need not worry about their uninsured neighbors. This is a quote from George Bush. I mean, people have access to health care in America. After all, you just go to the emergency room. But the president was wrong. As a rule, you can't just go to the emergency room in America unless you have the cash or the insurance coverage to pay the bill. Hospitals routinely turn sick people away if they can't prove they have the means to pay. This is legal. So we need to know this. We need to understand that we're paying too much for what we're getting in the United States. And if we're going to deal with the $36 trillion shortfall we're facing in Medicare, we need real health care reform. We'll be talking about this more in the future months ahead. Please go to my website. I have 30 detailed position statements on all kinds of things. And think about voting for me in 2010.